Hi, everybody. My name is Ben White, and I'm a senior technical consultant within Esri's Professional Services in our Health and Public Safety Department, or HAPS for short. And today, I'm going to talk to you about modernizing your public health data infrastructure so that you can respond in a timelier manner to public health emergencies, get the most out of your data, and make your communities more resilient in the process. Though I work at Esri, this talk will not be just Esri specific. So these concepts and practices you can put into place with or without our tech. After this presentation, it is my hope that you will have familiarized yourself with what we mean when we say this overarching umbrella term of data modernization. You'll understand why it's important. You probably do already because you're here at this talk in the evening during a conference. You'll learn a little bit about Geographic Information Systems, or GIS, which is what Esri does, and you'll understand why it should be an important part of your modernization strategy. And finally, and perhaps most importantly, you'll see real examples of how data modernization efforts that include GIS have helped strengthen the health of communities. So data modernization is a trendy term, but what does it mean? It depends on who you ask, right? So a director of informatics is probably going to have a different definition than, say, a group of emergency preparedness and response epidemiologists. Here are two definitions that I like and that I think really hit home. So the first one is data modernization is the process of updating and transforming data systems, infrastructure, and practices to modern cloud-based formats to enhance accessibility, security, and business intelligence. That's from IBM. The next one from CDC is modernizing data isn't just keeping pace with the present, it's about preparing for the future. By leveraging innovations like machine learning and innovating data sharing capabilities, we unlock new insights, streamline processes, and respond more effectively to emerging health challenges. So I personally didn't start out with a tech or computer science background, and I know that many folks in public health wear lots of different hats. And so with that sort of frame of reference in mind, here are some key kind of data modernization definitions that are distilled down into more approachable terminology. So when we say public health informatics, that's just combining data science, computer science, and technology to solve problems. When you hear a term like enterprise, um, that's organization wide. So it's not one program at a time, but you built once, used everywhere across the organization. If you hear something like federated architecture, right? That's different systems doing their own thing. So maybe you have a server here for a certain database and a server here for answering or handling web traffic, right? But they are talking to each other and they work together. And then there's the concept of data governance, right? So not only do you have data, but you have procedures and policies in place. So who owns that data? Who can use that data? What aspects of the data can they use? And how is it protected? So sort of on that same vein, data standards, right? So if I have a column, if I want to capture the report date of something, report date of an incident, report date of response, report date of a disease, a case of communicable disease, right? What does that report date actually mean, right? Um, and how is it stored, right? It shouldn't be a free form text where I can put a paragraph about the date, or and then a string field in one, and then a numeric in something else, and a date time field here. Like, how do you define your data schemas for ease of use? Um, Once those are standardized, it should be interoperable, right? So interoperability. Use the same version here and this use it over here. No more sending you emailing back and forth different versions and updates of a CSV, right, during a response. When you hear cloud computing, cloud just means it's computing that lives somewhere else, not on premises or on-prem for short, right? So you basically work with a vendor that has servers, right? Rooms and warehouses of servers. You can scale up, scale down. You pay for what you're using, right? And so during a big event, you could use a lot of servers, a lot of machines, a lot of computing power, and then you then shrink your resources back down. When you hear application program interface, or API for short, is what it's usually said. That's a way to talk to a system and ask a question and get an answer. Think of the analogy of a vending machine. If I, Ben, go to a vending machine and I want a bottle of water from there, right? I give it my token, right? My credit card, right? And then I type in the code that says I want a water. The machine recognizes that request. Ben wants a water and dispenses the water for me, the bottle for me to grab, right? Um, Real time, near real time, that's data that shows up fast enough to act upon. So not data that's a week old or a month old or data that, comes into the system, goes through a QA, quality control, cleaning process, right? Make sure it's ready to go and it's seen uh, real time or near real time. That could be tracks of ambulances, right? That could be boots on the ground doing overdose interventions, right? But that data is near real time. And so why all this talk about public health and data modernization? Well, back in 2019, the Council of State and Territorial Epidemiologists, or CSTE, published a white paper that clearly stated something many of us already have felt day to day in public health, right? Public health surveillance systems were falling behind technologically. One of the biggest reasons for this is legacy infrastructure. So public health systems were never designed for real-time or near real-time decision making. And this makes it incredibly difficult to respond during emergencies or rapidly evolving situations. This white paper also called out how data silos are a major barrier. So data often live in disparate, separate systems, right, owned by different programs. Pulling this data together takes a lot of effort and a lot of resources, something that public health departments increasingly lack. As a direct response to these challenges identified in the white paper, CDC launched the Data Modernization Initiative, or DMI, in 2020, with their goal of creating a quote, modern, integrated, and real-time public health data and surveillance that can protect us from any health threat. So the summary findings of that CST white paper are these five sort of recommendations, and they are as follows. So one is an enterprise approach to modernization. So this includes a common core data infrastructure. Segregated systems create redundancy in infrastructure and inefficiencies. So not the good redundancy like a backup, more data is in different versions and different systems and they're not talking to each other. So interoperable data systems. So systems must be able to talk to one another and make room for non-traditional data sources. So not just tabular data, but pictures, tweets, TikTok stories, images, pictures of documents, right? Audio clips from interviews, you name it, right? All different types of data, all stored and all being able to be retrieved by other systems. These modern data systems should be secure, so not only to prevent the advanced cybersecurity threats of the day, but to bolster the public's trust of our work. A trained and competent workforce. So train and foster a tech competent workforce. It does no good to have a super sleek, shiny new modern data system if everyone is afraid of using it or doesn't know how to get the answers they need in a timely fashion. And then finally, partnerships and innovation. So you shouldn't and likely can't go it alone due to time restraints, funding restraints, you name it, right? So talk with your agency partners. That could be local, that could be neighbors, right? All the way up to state and federal partners. See what's been working for them. What are they using? What technology are they using? What pains have they had, right? If they're contracting with private companies like Esri, right? What are they using from them? What do they like? What do they not like? What do they want control over more that they don't, right? So don't reinvent the wheel. Look for partnerships. And so NACCHO, the organization whose conference we are currently enjoying, uh, surveyed around 1,200 local health departments or LHDs in 2024 regarding their public health informatics approach. And 61% of those, so there was a 43% response rate, I should say, but 61% of respondents had no in-house informatics staff. 50% of their preparedness programs were using informatics, which is great. 57% of those LHDs were actively working on some data modernization, and 60% said they have some type of data modernization planning. And all of this despite only 25% of respondents saying they had received additional funding to modernize. So the majority know it's an issue, wanting to make strides towards it, having a gap between what they want to do and funding, but still going forward with what they can. That same survey identified common challenges with outdated data systems. So if you don't modernize, here are the challenges that you are likely having, like these respondents did as well. The biggest one, shock to no one, I'm sure, is the lack of funding, right? So 66% of respondents said they don't have the funding to fund informatics. The next two were data exchange issues between other entities. So how do we share our data with these legacy systems to our state or partner or local partners, right? Maybe for multi-jurisdictional outbreaks, right? For multi-jurisdictional emergencies, how do we share with these sort of outdated, antiquated systems? They also lack statistical software. Excuse me. So like no R, no SAS, no Stata or Python to do crucial analysis to find patterns in their data. They might be using Excel still with spreadsheets and maybe some macros or pivot tables. Also outdated infrastructure. So maybe one of your employees a long time ago built a database and was the sole manager of it, right? And then they retired and nobody knows what to do with it. No one knows how to upgrade it. They are afraid if they touch it, they break it. So we are stuck with the system that we have. All these challenges can be addressed through data modernization, and you can also make it customizable, right, to focus on which of these are particular pain points for your organization. And so if you're looking to implement some sort of data modernization, you don't know where to start, there are a few agencies that have created some very helpful toolkits to aid you in your process. So the first is CDC's DMI, like I mentioned. They have a public health data strategy on the left here, and they have an Informatics 101 series, which can help you sort of plan your approach. The Public Health Informatics Institute has developed a data modernization initiative toolkit that has planning steps, milestones, everything you need to sort of figure out your path, what data modernization means for you. And then NACCHO as well has a toolkit and other helpful resources. If you are a member, you just go to their resources hub, search for data modernization or public health informatics, and you will find the resources that can help you. Of course, no talk about data modernization would be complete without mentioning artificial intelligence or AI. It's all the rage right now. I'm not going to spend too long on this topic because I want you to walk before you run. And so, again, that same NACCHO survey indicated that only 5% of local health departments were actively using AI in 2024. This was either due to security or privacy concerns, hesitance due to unfamiliarity, resistance due to job security, a myriad of things. However, 84% of those LHDs surveyed planned on using AI in 2025. AI was a big topic at APHA this year in Washington, D.C., including issues around, or topics and presentations around trust, accuracy, reliability, and legal compliance when trying to use AI to improve public health. Those same concepts that go with data modernization, so standardization and governance, workforce preparation, trust, these all are at play with AI. And so AI is a component of, but not a replacement for data modernization. And so here I'm showing you the Kansas Health Institute. They have a framework and guidance document here for developing AI policies for public health organizations. So great resource. Go ahead and take a look. Kind of to drive this point home, right? A recent article from August of 2025 in Forbes highlighted how it's important to treat AI as a complementary, so complementary to, but not a substitute for data modernization. If you keep your current outdated systems and just try to throw AI at it to solve problems, you will fail. Um, these are two great quotes from the article. So they don't adapt their processes, they just try to bolt AI on top. That's a recipe for unreliable results, growing mistrust, and failed projects. Ignore the fundamentals, and you're building on sand. Another great quote, easily 60 to 70% of AI's growing pains trace back to data infrastructure. It's overlooked because it's invisible, not a flashy innovation, just the hard grind of IT and governance. But without it, no AI system in a company will ever deliver. And so now I'd like to switch gears a little bit to talk to you about what a geographic information system or GIS is and how it can help you in your data modernization approach. So what is GIS, right? It's a system for managing, sharing, and applying geographic information. So GIS stands for Geographic Information Systems. They have been around since the late 60s. And GIS is a way to create, manage, analyze, and map or visualize all types of data, particularly spatial data. And that includes point data, like locations of shelters and clinics or cases of disease. Excuse me. Polyline data, so like rivers and roads. And you can have attributes of, is that road damaged? Is it closed? Is the river flooding? Polygons, like jurisdictions for responses or changing fire perimeters during a wildfire. Those data are what we call vector. You can also bring in what's called raster data, which is like an image, right? Pixel data. So that can be something like aerial photography of a town after a tornado. It could be thermal imaging, right? Trying to find somebody during or a party during search and rescue, right? Lots of different data types. And so in a GIS, you can think of sort of these 4 or 5 different like components, like tiers of components. We have the back end, that's the data infrastructure that like databases or with lots of data, right? Like data lakes, data warehouses, sort of unstructured data. You can have data connectors and generators like location-based sensors, think of like a traffic cam, right? Or a weather sensor, like a snowtail site. Data feeds, like if I have sort of a computer-aided dispatch and I know the location of my vehicles and they leave breadcrumbs like geopoints of their tracks throughout the day of response, right? Desktop software is common in GIS, so a way for analysts and or epidemiologists, right, to perform some kind of analysis, summarizing spatial stats, right? There are field data collection mobile apps to be used to do surveys or collect pictures, right, for inspections. And there's a sort of front end, so web-based maps and applications for sharing and consuming that data, sharing it with key stakeholders, sharing it with partners, sharing it with the public. And so with a GIS, say you can enrich your data with spatial attributes. So that includes space, that can include time or space time, right? And to do so, there's a leading body, the Open Geospatial Consortium, and they produce standards and guidelines to adhere your data to so that it can is most usable across all different types of GIS platforms. Um, Esri's ArcGIS platform extends across all those different levels of an enterprise GIS system and connects to all those spatial databases I'm showing, and that's this top row of this chart, right? Plus a few others. And like I mentioned, though I work at Esri, there are a myriad of other different GIS systems aside from ArcGIS Online or ArcGIS Enterprise. For example, at my last job prior to joining Esri, we utilized a combination of QGIS, Postgres database, GeoServer for serving WebGIS layers, and custom app deployment for going door to door for basically a mobile app and a desktop app to suit our GIS needs. The nice thing with Esri is that it is all sort of in the same environment and ecosphere, right? So that's I've kind of highlighted those in that purple hashed area, right? So we have enterprise, we have desktop software, we have ways for interacting with data sources, and we have low code to no code front end applications. But you could piece together all these different types of technologies to make a GIS that best suits you, depending on how much you want to be sort of involved and control under the hood, right? Um, so you've got spatial databases here, authoring and analytics desktop platforms, content hosting, APIs and client libraries for developing web apps, right? And then that front end web map or app, right? And so again, at Esri, it's built, our ArcGIS system is built on what's called the Well-Architected Framework, or WAF for short. It's a collection of concepts, system patterns, best practices, all intended to help organizations design, build, and operate ArcGIS as a system, not just a collection of tools. So it provides system patterns, best architecture practices, adheres to these sort of 4 pillars of integration, automation, observability, reliability, performance and scalability, and then security. There's lots of different design deployments and ways to help you evolve your GIS over time. So it's not just a one and done, one size fits all approach. You can scale your GIS as needed. And other technologies like Amazon Web Services, they have similar sort of well-architected frameworks and best practices. So that's a term you might see throughout as you adopt different data modernization technologies, right? A well-architected framework. And so now onto what's probably the most or more interesting part of the talk, We've talked about data modernization. We've talked about what a GIS is. And now I'd like to walk you through some examples of how data modernization that includes a GIS has been able to directly benefit communities. This first example is breaking down data silos. And so it is the integrated data system from Adams County Health Department in Adams County, Colorado. It's a Denver metro county. And so Adams County Health Department was formed in 2023 with the dissolution of Tri-County Health Department. They had data from different disparate systems and from two other counties they needed to tease apart. And this was a unique opportunity to create a brand new data system for a health department. What they created, the integrated data system, or IDS for short, is built on ArcGIS Enterprise, also databases, and what's called FME, which is a data software, or software, I should say, for pulling and getting different data feeds to work together to work to be able to be pulled and used from different sources. So Adams County also utilized what's called ArcGIS Knowledge. That's a graph database software native to Esri's technology. There are other graph tools and softwares, right? But a graph um, database to basically map the relationships between data sources, programs, and all those different sort of relationships in between. And so this replaced spreadsheet style communicable disease tracking. And it could also, for example, connect externally to the state's EpiTrax disease surveillance system. This enables better department-wide organization, de-siloing, and digitization of clients for intake forms for service referrals. And you can see um, who is in each of these different systems and how are these different programs using it. So, environmental health can see restaurant inspections, can also see air quality monitors, can also see, um, you know, um, environmental health spills, right? All these kind of different disparate data systems that now their connectivity is shown and mapped. That's that top image, which is a link chart, a way to visualize a graph database. And the bottom is an app, a dashboard, I believe, of community events and engagements that have taken place in and around Adams County. This next example of keeping the community safe through data modernization is the work done by Erie County Health Department in Erie, Pennsylvania. In February 2024, a food worker at a popular restaurant tested positive for hepatitis A, an infectious virus of the liver that in rare cases can cause permanent liver damage, liver failure, or death. And so Erie County developed a GIS-based workflow that included a public-facing Hep A vaccine clinic finder. That's that mapping application you see in the bottom. Um, They created a web GIS form for vaccine clinic registrants. So it eliminated paperwork and data reentry. So that's that green sort of long rectangular screenshot you see on the lower right. So where people who wanted to get vaccinated could enter their information, their contact info, right? Vaccine history, any pertinent exposures, right? That could identify them as needing to be bumped in front of the line in terms of being vaccinated, right? And so all this data was then fed in and monitored in different dashboards for monitoring patient wait time, clinic capacity, and real-time vaccine inventory at each clinic. And that's what you're seeing in that upper right. So the total number of people vaccinated, right? The average wait time from registration to distribution. Um, so when somebody enters their information, then when they went to go receive their vaccine, that information was immediately pulled up for the person vaccinating, right? They didn't have to re-ask information, enter it into a different system, all in the same thing, right? And this overall process was a huge success, resulting in over 400 community members being vaccinated in just 2 days, which seems remarkable to me. Amazing work. This is an example of sort of a modern emergency operations platform. This is from the city of Virginia Beach. And so this was spurred by There's Something in the Water musical festival back in 2023. There were 60,000 attendees, and during the festival, an F3 tornado touched down, damaging 115 homes and destroyed 12 homes. And all the damage reports that came in were paper-based. In addition to that, they have had multiple systems that needed integration. So they had computer-aided dispatch, they had 311, traffic cams, flood sensors, and a military base, right, that had a completely different system. And so to get a full picture of all these different things in the city required 14 different system logins for a complete response picture. Now those systems are all connected, sharing their feeds, right? And aggregating them to different units for looking right. So the each program, their day-to-day workflows stay unchanged, but the data that they are entering and maintaining, now they sort of can merge and work together to give that complete emergency response picture. And as evidence in terms of how the benefits, right? They built this in 18 months, but a 4-hour process to get a complete picture now takes 17 minutes. And they have fewer missed events. So they tested this out, their old system versus their new system in a recent air show, I believe. And EM managers issued 93% more alerts to city departments than they previously had. Not because they were 93% more, but because they actually found they were missing a good deal of events because of they had to look at all these different disparate systems that now they could see in one sort of ecosphere. And this is an example of just two of the dashboards in their emergency management system. So their different responses, right? Their watch alerts. Um, so ways to very quickly through their app see different types of events they need to monitor, all from different feeds. This other example is less map focused, but still very powerful. So the Texas Department of Emergency Management created the State of Texas Emergency Assistance Registry, or STEER. I love that acronym. So it's an application where citizens can self-report health needs, medical devices, prescriptions, or anything that would make them more vulnerable during an emergency response or make them more difficult to transport if needing to evacuate. Screenshots here include the main public-facing landing page on the left. The green is the registration survey. People can enter their information, right? And then the map dashboard in the back is just an example from Carlton, Texas, showing power outages. Currently, there are none in this screenshot, but also showing the location of folks who might need assistance, either pre-existing condition or medical equipment, you name it. The information in the system is kept around for 1 year, after which time the person has to re-register. So there's sort of data cleaning and data cleansing processes built into it to make sure it's accurate and up-to-date data. So someone has to re-register after a year. And to date, roughly, I think 10,000 people have signed up. This is a similar vein of signing of sort of surveying and registering folks, less of a map-based GIS component, but so the Medical Reserve Corps is a network in the U.S. of community-based units that initially are initiated to help with local organizations and meet, excuse me, public health needs of their communities. It's sponsored by the Administration for Strategic Preparedness and Response, or ASPR, part of HHS. So for the city of Bethlehem, Pennsylvania, they created this ArcGIS hub site where prospective volunteers can sign up to be part of the MRC. They enter their home address, their skill set, whether they wish to have medical or non-medical training, right, for their volunteer activities, the geographic extent at which they'd like to volunteer. So do they want to be deployed statewide? Do they want to stay just within the city of Bethlehem? And then granting permission for background check prior to being onboarded. The cool thing we mentioned earlier with data modernization and sort of the communication links between different entities, this actually feeds into the statewide system, SERV PA. So it's supposed to capture the local, but that data is shared up to the statewide as well. And MRC, you all probably know, but they work lots of cool different volunteer opportunities like vaccine education, vaccine clinics, and 95 fit testing, staffing first aid stations, and deploying during emergency responses. So really cool way to um, get volunteers signed up to help out in their communities for surge capacity. Here's another example. This is related to sort of disasters and evacuations. So during a hurricane, health facilities may find themselves needing to consider evacuating their patients. But do all facilities sort of assess that evacuation risk the same way? Probably not. And do they even have the capacity to assess that risk in near real time? And so with a modernized strategy, regulating agencies can implement sort of an automated risk assessment. And so in this example, You can take a statewide database of healthcare facilities that are licensed. That includes like their latest bed count, their patient census, their contact info, right? Their evacuation plan, say. So that's statewide, state maintained data, and then pull in live data feeds from Esri's Living Atlas. And that includes the storm path and severity of hurricanes and typhoons, 72-hour precipitation, wind gust, and wind speed forecasts from the National Weather Service, and from the National Oceanographic and Atmospheric Administration, or NOAA, their National Hurricane Center. They produce storm-specific storm surge probabilities, right? So 10% chance, 50% chance for storm surge, and in levels of feet, right? So how much water will be there with storm surge. And so combining all these different variables and scaling them based on hurricane subject matter experts, you can then create sort of a calculated risk index that's standardized. Says of all these different facilities, who's in the highest percentile, who's got the highest, most risk, right? And then optionally, you could also create what's called a webhook, right? And so um, say you identify 100 or 80 of the highest of facilities that are the highest risk, right? And you have their contact information. You can pull that in with a webhook, dynamically populate the facility, the email recipient, and email them and say, hey, we have identified you as being high risk. What's your evacuation plan? Are you evacuating, right? So really cool way to automate that process during what would be sort of a high stress event, right? Leading up to a hurricane. This is an example, sort of demo designed for the state of Florida. So you're seeing um, a hurricane, right? And then the index calculated for all these different facilities for 4,802 facilities. 128 of them are in red. They've been identified as sort of in the eye of the hurricane or in an area where maybe they're not quite a direct hit, but the storm surge is also going to cause severe issues, right? And so this is a dashboard approach to sort of combining visualizing those different data sources and the analytical results of the risk. This is an example from the California Environmental Protection Agency, or CalEPA. They've created what's called as the Cal Heat Score. And so this is a public facing application. It shows the daily heat index scores across California's zip codes. It's not just heat, though. It is a combination of historic temperature data at that zip code, 24-hour forecasts from NOAA, also ED or emergency department heat-related visits in that area. So as a factor of like capacity, right, during extreme heat events. And so they combined all this data to develop a model of the relationship between ED visits and health and heat stroke, right, or heat. Um, so that index is sort of zip code specific, right? So like it's way hotter in Sacramento than it is in say in San Francisco and Oakland, right on the sea, right? And so that sort of this scalable again index for health heat related illness. And so also at each zip code, they've brought in this other demographic data so you can see what's the population there for high risk, young and old folks who are not as heat tolerant, right? Folks who are in high risk occupations like outdoor laborers, right? And also where are the nearest cooling centers? That's that second tab on the map. And this application is a partnership with the Department of Insurance, Cal OES, which is their Office of Emergency Services, the Governor's Office for Land Use and Climate Innovation, and the UCLA School of Public Health. So lots of different agencies, again, supplying data and working to create this final product, which can help folks in a heat emergency. This example is from Washington State Health Department and is an example of local entity data exchanges. So here they're pulling in press releases from their local health departments, and it's obtained, I think, daily to help inform the communities of potential measles exposures. So here you're seeing that there's 19 active locations in the state identified as potential measles exposures. And this data, again, pulls in from the local health departments and is checked and verified to compare with the state's measles tracking of cases, right, reported cases. There's a tab here showing, again, the exposure and not only the location of the exposure, we mentioned spatial, but time, so space time. So this place during this time frame is when you could have been exposed. And then there's information on what do I do to if I feel like I have measles, right? Or what are the signs to check for? How do I report it? Or how do I seek care? And so great resource for trying to do some outbreak community engagement. This is from the Kansas Department of Emergency Management. This is the KDEM situation report, and it brings together data from emergency management, weather, and other mapping organizations to provide the most up-to-date and accurate information possible to support statewide situational awareness, disaster preparedness, and emergency response. So this situation or SITREP has 4 templates that are season specific. So spring, summer, fall, winter, right? Based on those hazards like droughts or snowstorms or fires, right? Um, Great app. And there's other states that are doing similar things like Nebraska, Colorado. Lots of states are starting to implement this, but it's a great way to see the current real-time snapshot of the situation on the ground. Um, this final example is a story from, again, sort of like a public-private partnership. So this is PG&E in California, which is a public energy utility company. And in California, they have what's called we have them here in Colorado now too, but public safety power shutoffs, or PSPS, which is a great acronym. These are done to reduce the risk of wildfire during certain conditions, right? Red flag warnings, you name it, droughts. These shutoffs are sometimes are planned, sometimes they're unplanned, right? And so health departments, including and insurers like the Inland Empire Health Plan, can look at this app and look for the intersection between uh, people on durable medical equipment, right, like ventilators and things, um, and these power outages to understand how the medically vulnerable might need help. So that could be they need generators, they need relocation, and so this map pulls from different data sources, right? Demographic data, um, state resources, and then the public utilities grid database system. And then I've highlighted in the bottom right here with this blue rectangle, but there's a link to the community resources for folks to identify, okay, so I am in this boundary of a power outage. What are my resources, right? So those are all the examples that I have. Um, Thank you for coming to this presentation. If you have questions regarding the demos that I've given or any content of the talk, please feel free to reach out. This is some of the great folks at Esri who are doing health and GIS work. So Georgie Trebizo is the state and local health practice lead. Maureen Granny is the senior account executive for Health and Human Services, and Angel Baltazar is the new director of Health and Human Services. And that's her email in the upper right. If you have questions, please feel free to email her. Or if you want to get in touch regarding how Esri can help you. And then if you have questions regarding this presentation in particular, or just other topics you want to ask, this is my direct email. And thank you all, and hope you have a great rest of your day.